Government of India just hours ago has agreed to extend the gap between two doses of Covishield from 6 to 8 weeks to 12 to 16 weeks now. As an expert, what do you think that this extended interval is beneficial from the efficacy standpoint, or like the critics suggest, that this might be just another cover-up since there aren't enough vaccines in India for that?
I would not refer to it as a cover-up. When you don't have enough vaccines, what you've got to do is try to get as many people vaccinated as you possibly can. And for that reason, when you have a shortage of vaccine, extending the duration between the first and the second dose in order to get more people to at least get a first dose is a reasonable approach. The fact that you delay it that long, it is very unlikely that it would have a negative effect on the efficacy of the vaccine. So in many respects, when you are in a very difficult situation, the way you are in India, you have to try and figure out ways to get as many vaccines into people as quickly as you can. So that, I believe, is a reasonable approach to do. I wouldn't call that a cover-up at all.
All right. Still sticking on to the vaccines. Now, Dr. Fauci, what are your views on the efficacy of the co-vaccine in India, which is made in India? And also, India will start rolling out the Sputnik in a week's time from now. What are your views on that vaccine?
You know, I don't have much information on the COVAX, but what I do know is that the reports that I've heard about the Sputnik is that it seems to be quite efficacious, you know, at a high level, close to 90% or so. But I don't have enough information on the COVAX to really say anything that would be helpful.
Right. Back in the United States, just last year, especially in New York, we did see the Department of Defense take control of the pandemic hands-on. Do you suggest that the military in India should step up at this point?
Well, obviously, that decision is going to have to be made by the Indian authorities. But I do know that particularly the thing I had suggested in another conversation with Indian journalists is that you can use the military sometimes to get things done quickly that you otherwise in the private sector would not be able to. For example, I know that there's a shortage of hospital beds right now, that people who need to be in a hospital are not getting into a hospital because of the shortage of the beds. You can get the military to put up field hospitals the same way they would during time of war that could serve as a substitute for the classic hospital. In the United States, we have used our military to get the distribution of the vaccines to various locations throughout the country. In fact, the person that was put in charge of that is a four-star general, General Gus Perna, who is responsible for efficiently and effectively getting doses to multiple different locations throughout the country.
Regarding resuming the travel, what threshold would you like to see established in order to determine whether it's safe to resume travel to India? And do you think vaccine passports could be a way forward?
Well, vaccine passports, I will not be mandated ever centrally from the United States federal government. But certainly we already know that there are going to be different organizations that are going to be requiring validation and verification of vaccination. One of them may be airlines. So I don't think the government is going to do it. But several of the airlines may say you're not going to be able to fly on our flight unless you have a verification that you've been vaccinated. In essence, a vaccine passport. But again, to repeat that, at least in the United States, that is not going to be mandated from a federal standpoint. And with regard to travel, it really is going to depend on the level of infection. Right now, India has a very, very, very level of infection. And that would mean that it would be very, very difficult to resume travel there right now.
All right. From a public health point of view, how did India really get to where it is today? And what can India do right now so that things start getting better in a much meaningful way than what it is right now in India?
Well, you know, there's the immediate issue that needs to be addressed is taking care of the people that are already infected. And that's getting better supplies of oxygen, oxygen cylinders, oxygen generators, PPEs, therapies like remdesivir, and things like that. The things that the United States has helped India with. But then probably in the intermediate and long run, you've got to figure out a way how to get as many vaccinations administered to the people of India as possible. You mean, obviously, it's a very, very large country with a population of about 1.4 billion people. You only have a couple of percentage of the people who are fully vaccinated, and about 10% or so that have at least one dose. So you've got to work out arrangements with other countries, other companies at the same time as ramping up your own capability of making vaccines. Because as we all know, India is one of the best, if not the biggest, vaccine producer in the world. So you've got to use some of those resources for your own people.
Right. Now, like you said, India is one of the best manufacturers in the world, but things are very, very tight and dire right now. B1617 has now been found in more than 30 countries, including the United States. You've repeatedly said that the global pandemic requires a global response. Do you think it's time for America and other countries to turn over to global vaccinations quickly, since a lot is at stake, not just in India, in other countries like Africa, which are so dependent on India for vaccinations?
Well, yes. I mean, I believe that the rich countries and the countries that have the capability of making and distributing vaccines really do have a moral responsibility to assist those countries that don't have the capability of doing that, particularly low and middle income countries. We did this with HIV, with the PEPFAR program, the President's Emergency Plan for AIDS Relief, which at first was directed to Southern Africa. I'm sorry, but my phone is going off. But I think that we need to try everything we possibly can.
All right. And do you see any?
Okay, we're going to have to wrap up.
We're going to have to wrap it up.
Sure.
This is the White House.
Right. Yeah. Just the last question. Do you see a realistic timeline for this rollout of vaccines from America to India?
No, I don't. I can't predict that. I'm sorry. Yeah.
All right.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.